Dr. Chris Biggerstaff. I'm a practicing veterinarian here in the Antelope Valley. I've been in the Antelope Valley for 25 years. I've owned Quartz Hill Veterinary for 8 years. I also own a practice in Rosamond that we opened in 1990.
So I understand you did a surgery recently, a TPLO.
Yeah, we do a number of those types of procedures. A TPLO, it stands for a tibial plateau leveling osteotomy. It's a surgical correction for a dog with a ruptured cranial cruciate ligament, and the human equivalent is an anterior cruciate ligament. Something that we hear about regularly if you follow NFL. The NFL football players, it seems, are regularly, tearing their anterior cruciate ligaments or ACLs. We have to meet Melissa. She's my surgical technician for these procedures, and she's made my life a lot easier. She's learned what the equipment is. She's learned how to take care of the equipment, and she's learned what steps to anticipate. So I don't have to look for a specific instrument. She's got it in her hand, ready to go, and it sped the time up, probably saving me a half an hour per procedure. At this point, after we've done probably a couple hundred of them together.
So what has your experience been here with Quartz Hill Veterinary?
I've been here for, it'll be 2 years in September, and I've been doing orthopedics with Dr. Chris for 2 years. Well, I've done the ACLs, the surgeries, for probably 4 years, but this is a totally different procedure. Since the TPLO, it's a different technique, and I've only been doing that for 2 years since I've been here. It's really cool to see them. They're coming in limping, and then when we're done with them, they're walking out very, very well. And to see them from 2 weeks post-op to 4 weeks to 6 to 8, huge improvement. It's absolutely amazing. And the owners are always very happy, just as well as we are.
How does the TPLO technique compare to that lateral suture technique that you did at your previous job? The results as far as how does the dog respond and in what period of time?
Yeah, normally when they're out of surgery, they come out with 3-legging it. With this procedure, they're toe tapping already from the next day. And 8 weeks, they're using it, they're walking very, very well. And with the lateral suture, it took a lot longer.
It was one of the previous techniques. It was the technology we had at the time was, they call it the lateral suture technique, which just equated to a very large piece of nylon suture placed in the same angle as the ligament to stabilize the joint. But it never did anything to change the geometry of the joint, which was the underlying problem. We could stabilize the joint with a big piece of monofilament, but it didn't change the geometry. And the dogs just didn't respond near as rapidly. Melissa's saying the dogs are walking out of here the next day. That's not an exaggeration. They come in on 3 legs, and 24 hours later they're already placing that limb on the ground. And with that previous technique, it could be weeks and weeks and weeks before the dog would even be putting that down. And 6 months for a full recovery with that lateral suture technique versus 8 weeks. 8 weeks the bones are healed and we're turning them loose. So they're on their way.
What would you say? Who talks specifically with the owner and tells them all of this, and how does that process go?
Well, I would have an initial consult with them. If they're contemplating the surgery, we're in contact almost immediately if that's the direction the case is going to go. Try to keep communication channels open, because there's always a lot of questions. It's because it's a complicated procedure and it's expensive. People have a substantial investment, excuse me, and we want to make sure that they feel they get the value for that investment.
Is there anything else you guys can think about on this subject to tell us, or?
Well, it's exciting from our standpoint. I guess it's hard to get a pet owner excited with the thought that their dog needs surgery, but the results often speak for themselves. So, so nobody wants to be faced with surgery, whether for them or for their dogs. But if they are faced with it, we've got a technique available that just gives results far beyond what I thought we could ever attain, 5 or 6 years ago.
Cool. And if you can just give me a nice outro again, who you are, what your mission as Quartz Hill Veterinary is, and invite people to come in and see you for a consultation, or you can be in it too. And smile with us.
Neither of us are smiling a lot. Both of us got poker faces. I don't want to go there, man. Those guys don't even smile. So, well, it's a Quartz Hill Veterinary Clinic. It's Dr. Fly established it, I think 22 years ago, and I took it over from him again almost 8 years ago. You know, got a great staff, real caring staff, and really knowledgeable doctors. I think we set ourselves apart from a lot of other practices in the area because we really make an effort to find treatments and protocols and solutions that fit the owner as well as fit the pet. We listen to our clients and we try to find solutions to their challenges that are best suited to them. Everybody has a little different expectation of what they want for their pet, and everybody's got a little different budget, whether it's emotional or financial, but we work very hard at Courtsville to find a solution on an individual basis, for each individual pet owners. Our slogan is caring for people who care for pets, and that just means that our focus is with the owners and their pets, not simply the pets themselves.